Hi, I'm Art Caplan. I head the Division of Medical Ethics at NYU School of Medicine. President Trump's Department of Health and Human Services has issued regulations recently that permit physicians and nurses, pharmacists, and other healthcare workers to refuse to provide services to their patients if they have religious or personal reasons for a conscientious objection. I think this policy goes too far, and there are some counties and states that are suing to try and overturn it. Obviously, there are situations where a physician might say, I have a deep moral objection to doing something. We don't really demand that people get involved in providing abortions when they find it morally outside the realm of their personal beliefs. We don't demand that people get involved in the states that have legalized assisted suicide in providing it when it violates their personal beliefs. So I'm not saying that there aren't grounds to have conscientious objection. On the other hand, if somebody shows up at a pharmacy with a legitimate prescription and the pharmacist says, I'm against day-after pills, that doesn't seem to me to be the same as asking them to provide a service that they find morally reprehensible. Legitimate medical prescription, I think, has to get filled. Maybe you can pass that on to another pharmacist at where you're working or someone down the road. However, you had better be prepared to minimally say, I don't like to fill these prescriptions, but here's how you get it filled. Every patient, even when it comes to physician-assisted suicide or abortion, every patient has the right to know what their options are. It's basic informed consent. So unlike the HHS ruling on conscientious objection, I think you've got to tell people, I can't do this, but here's how it gets done. And I'll add another restriction. If it's an emergency, say a woman is dying because the fetus is caught in the birth canal and the only way to save her is to do an abortion, I think you got to do it then too. We're not in situations where some procedures are purely elective. If life and death hangs in the balance, patient welfare and patient interests dominate. One other point, I've started to hear stories about medical students saying, I don't want to train on this, I don't want to study this, I have a moral objection, I have some reason I believe in, say, natural foods, and I don't want to study vaccines or whatever it might be. If you open the door to any and all conscientious objection on the part of healthcare workers to not do what we would normally expect doctors, nurses, pharmacists, and others to do, I think you are starting to really put the doctor's interest ahead of the patient's, and that's wrong. It's not what the Hippocratic Oath says. It's not what various codes of ethics of the medical and nursing professions say. They say patients first. So only as a last resort ought we be permitting doctors to say, I'm not going to do X. Only as a last resort would we allow them, should we allow them, I think, to say I'm not going to do X if there's others who will, and so the patient can still receive the services they need. Conscientious objection is important. We want our physicians to have values, to think hard about what they're doing, to understand that sometimes they may not want to go along with a particular practice. But an open-ended, if you will, invitation to let anybody block anything they don't like, anything they don't want to do at any time, I think is going to lead to far more problems than it is protection of physician and healthcare worker rights. I'm Art Caplan at the Division of Medical Ethics, NYU School of Medicine. Thanks for watching.